Pleasant good morning and a very warm welcome to the Ministry of Health's update on the national COVID-19 response for Monday, 18th October 2021. Our panelists for this morning's update are Dr. Roshan Parashram, our Chief Medical Officer of Health, Ministry of Health, Mr. Davlin Thomas, the CEO of the North Central Regional Health Authority, and Mr. Roshan Siram Singh, Geographic Information Systems Manager from the Epidemiology Division, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health and your moderator for this morning's update. The CMO will begin with the latest clinical and vaccination updates.
Hi, good morning. Thank you, Mr. Alexander. Good morning to Mr. Thomas, Mr. Siram Singh, members of the media, members of the viewing and listening public. If I could begin with my first slide, which is the COVID-19 update for October 17, 2021, please. It shows the total number of tests done in the public and private facilities now stand at 374,677. New positive cases over the last 24 hours, 227. Total recovered patients thus far, 48,141. Of a total positive caseload since March 12 to present of 54,114. In terms of our persons in home isolation, we have 3,835. Active cases now stand at 4,373. And persons in hospital, 268. Those in step down, 43. In our quarantine facilities, we have 126 persons at this time. In terms of our deaths, we have 1,600 deaths to date since the beginning of the pandemic in Trinidad and Tobago. And condolences to the families of all of those who would have lost loved ones during this time. The vaccination update, total persons vaccinated with a first dose of a two-dose regime, and these figures slightly differ from what you're seeing on your screen. This is as of Sunday, which is yesterday at 8 p.m. 611,053. Total persons vaccinated with a second dose of a two-dose regime, now 536,373. Those with the single dose Johnson & Johnson, 30,437. And persons who would have completed any vaccination regime, 566,810. A population coverage level of just under 41%. In terms of those accessing the parallel healthcare system who are not fully vaccinated, 3,866 of 4,090. 94.5% based on data from July 22nd to September 29th. If I could have my next slide, please. So, of those persons who are hospitalized, as I just said, 94.5% would have been not fully vaccinated. And in terms of our deaths, we're hovering about 98% of persons who have died from COVID-19 in Trinidad and Tobago have not been fully vaccinated as well. And we have a country that has quite a significant load of comorbidities in terms of our prevalence in the population. And these diseases that I'm going to show you, asthma followed by diabetes and hypertension, have been, those persons who suffer those diseases have been having a predilection towards complications and deaths from COVID-19. And we're really asking these people, starting with asthma, who have not been vaccinated to date, to please come out and don't delay and get vaccinated as soon as possible. Because of the underlying condition, you are prone to complications of COVID-19 and of course other respiratory diseases, and we are asking you to get vaccinated as soon as you can. Next slide. So if you go to the second slide, you'll see again similar narrative, but this time for diabetes. You would have seen this slide before. Again, persons with diabetes, locally known as sugar, are 3 times more likely to have serious complications from COVID-19 than persons without diabetes. And diabetics are more at risk of hospitalization and death from COVID-19 as well. So again, just to underscore, people have been saying that if they have diabetes, they can't take the vaccine. The contrary is true. If you have diabetes, you should take the vaccine, and you should take it as quickly as you can. So again, the message is, if you have diabetes, don't delay, get vaccinated today. And the last condition, if I could have the last slide, in terms of hypertension, 1/3 of the population of Trinidad is thought to have hypertension, some known, some unknown, and people with other non-communicable diseases, hypertension, high blood pressure, have a more likely outcome, poor outcome, if they do get COVID-19. And again, we're really asking persons with these three complications, hypertension, these conditions, hypertension, diabetes, and asthma, along with other conditions that we have said in the past, obesity, and other chronic immunologic states that lead to some sort of compromise of your immune system, to come out and don't delay, get vaccinated today. Back to you, Al.
Thank you very much, CMO. I now invite Mr. Siram Singh to present the latest GIS update. Good morning, Mushan.
Thank you. CMO Dr. Parashram, CEO Mr. Thomas, Mr. Alexander, members of the media and members of the listening and viewing audience, good morning. Today we begin by taking a look at our point map, the first of which represents the period epidemiological weeks 38 and 39, with epidemiological week 38 covering the period the 19th to the 25th of September, and epidemiological week 39 covering the period the 26th of September to the 2nd of October. We look at this map and we compare it to our second map, which is also a point map, which covers the period epidemiological week 39 and epidemiological week 40. So again, epidemiological week 39 covers the period the 26th of September to the 2nd of October, and epidemiological week 40 covers the period the 3rd of October to the 9th of October. And then looking at both of the maps, we recognize that the pattern is generally the same, with cases favoring the densely populated areas and along major road networks where we have settlement taking place. Now we switch now to our choropleth maps, which are essentially count maps at the community level. And as we take a look at the first community level map, which covers the period epidemiological weeks 38 and 39, so when combined, we are looking at the period the 19th of September to the 2nd of October. We note this map and we compare it to the next map, again, in this case now, covering the period epidemiological weeks 39 and 40. So there's the overlap with epidemiological week 39. So the period covered here will be the 26th of September to the 9th of October. And in comparing both of the maps, we recognize that there's fluctuation taking place at the community level, and a few of the communities continue to record a high number of cases. The key message is that regardless of which community you live in, regardless of if that community is recording a high or has recorded a high number of cases or not, we all need to be vigilant. We all need to continue to practice the measures and guidelines that have been provided. We need to continue to wash our hands, watch our distances, and wear our masks. And most importantly, we need to take the opportunity to get vaccinated. We switch now to our chart, which provides us with a look at the number of cases mapped per county during the period epidemiological weeks 37 to 40. So the period covered here will be the 12th of September to the 9th of October. And what we see at the county level generally is that there's fluctuation taking place in many of the counties. However, we note in 3 of the counties, namely St. Patrick, Victoria, and Tobago, there has been a downward trend, a continuous downward trend in these counties. Apart from that, we know that there's a very small continuous upward trend in the River Mayaro. But of course, the River Mayaro continues to record the lowest number of cases among the counties. As we switch now, we take a look at our national space-time trend analysis map. Again, covering the period epidemiological weeks 37 to 40, so the 12th of September to the 9th of October. And most areas continue to not display an identifiable trend. So we cannot see in most of the areas whether there's a continuous increase or continuous decrease in those areas. However, there are several areas in the country, across several of the counties, which are showing upward and downward trends. We'll take a look at some of these counties now. We switch firstly to County Victoria. And we note that County Victoria continuously recorded the highest number of cases. However, as we look at the map, we note that there are fewer areas showing that continuous upward trend. As we switch to County Victoria, please. Yes, thank you. Fewer areas. So what we are seeing is that there's less concentration in these areas, but there's more fluctuation, which generally holds in the other counties. As we switch to County Carney, we will see a similar pattern. The second highest number of cases were recorded in County Carney over the period. And again, fewer areas showing identifiable trends, but a few areas scattered throughout the county showing upward and downward trends. We now switch to County St. George East, with the third highest number of cases recorded during the period. And we know that there are 5 areas showing strong upward trends. However, generally, in most areas across the county, we are seeing no identifiable trend. Of course, we take this in the context of the general numbers recorded per county, the total number of cases recorded per county, and we take this in the context of the fluctuations that are taking place across the country. Finally, we just remind everyone that to access credible information, we could access that at the Ministry of Health's website, and one of the GIS products that is available will be the COVID-19 dashboard. To access this, we can visit Ministry of Health's website at health.gov.tt, and we can navigate to the appropriate drop-down to access the information which we require. Thank you very much, and I hand back over to Mr. Alexander.
Thank you very much, Mr. Siram Singh. And we now welcome back Mr. Davlin Thomas to share with us the latest vaccination figures and how the vaccination outreach that is currently ongoing has impacted the uptake in the NCRHA. Mr. Thomas, good morning.
Thank you, Mr. Alexander, the communication specialist at the Ministry of Health, the CMO, Dr. Roshan Parasram, Mr. Roshan Sigram Singh, Manager GIS at the Ministry of Health, to the members of the media, the staff at TTT, and the listening and viewing public. Good morning. Just some highlights in terms of the areas, the health centers that are providing vaccinations within the NCRHA. They include the Arima Health Facility, the Blanchisseuse Health Center, the La Joquita Health Center, the Maloney Health Center, San Rafael Health Center, Talparo Health Center, the Chaguanas District Health Facility, the Cunupia Health Center, the St. Helena Health Center, the Aruca Health Center, Macoya Health Center, St. Joseph Enhanced Health Center, and the Tacarigua Health Center. The mass vaccination sites under the purview of the North Central Regional Health Authority continue to be the UTT campus at Monroe Road, Chaguanas, the Wallerfield Raceway drive-through facility, the Costat El Dorado campus. And in terms of our outreach, we've engaged vaccinations with Lopino Bonnet West, the Larry Gomes Stadium, the Farmers Market, the Trinity Mall, City Center Mall, Chaguanas, Price Mart, Chaguanas, and the Extra Foods Arima, including a number of collaborations with various MPs that have been fruitful in terms of at least 25 vaccination drives over the last 2 months or so. The other highlights in terms of our collaborations with and partnerships with other organizations, private organizations, includes the Fernandez Compound, the Foundation for the Enhancement and Enrichment of Life Field, the Farmers Market, Ministry of Agriculture, the Pennywise Employees, Chamber of Commerce for Chaguanas, the healthcare and other frontline workers at private facilities, the churches, temples, and mosques, members of the Chaguanas Lions Club, the CL Branchfield and Company, the Montrose Business Association, the Airport Authority of Trinidad and Tobago, TNTEC, and the TTMA. The total number of vaccines, inclusive of Sinopharm, AstraZeneca, and Pfizer, and Johnson & Johnson, that the overall total of vaccination doses distributed by the NCRHA to date is 243,610. That's 243,610. We continue with the Elderly Express experience, which is engaging with a highly personalized premium VIP experience for the elderly. The total number of elderly that we've engaged at their homes and at the elderly homes as well is 1,355 at approximately 71 homes. The NCRH again continues to applaud the bias to action of its staff, who are bright, shining stars illuminating this COVID-19 sky. The NCRH also has put in a number of contingency plans for worst case scenarios. One of them is the preview app, which is the NCRH's COVID preview app on Play Store. We currently are monitoring 118 persons on that app. They have all been called by physicians. We have, for example, 64% of them accessing the tips on the site. We have a typical user accesses the site for the SpO2 monitoring 3.7 times per day, which is fairly frequent, and that our average response time to a new user is directly implying a direct call from a physician is 1.5 hours. We also continue our telemedicine program to stymie the possibility of an avalanche of those NCD patients post-COVID. We've had 40,000 calls thus far via the NCRT to our inherent patients. Our current patient load is approximately just 15,000, so it means that they've been called at least 2.5 times. In addition to that, we continue to build capacity for in terms of training for worst case scenarios. So we have practical airway management training sessions for critically ill patients at ICU and HDU. That is ongoing, with at least 50 persons, house officers and registrars being trained within the last month. Our COVID-19 emergency care training, level 1 for patient escorts, and again this is for worst case scenarios, for patient escorts, patient care assistants, etc. We've trained 268 members of staff. For our emergency care training level 2, those are for registered nurses and house officers, and particularly for house officers or PCP ones operating within the primary care. We've trained 295 members of staff in that emergency care training. And our emergency care training level 3, targeting the PCP 2s, which is a higher level of the primary care practitioner. We've trained at least 100 of them thus far. Guidelines, training and guidelines for management of COVID-19 patients on wards. We've trained 399 of our RNs, ENAs, and head nurses, nurse managers, house officers, etc. for management of recovered COVID-19 patients with pulmonary complications, and we've targeted house officers and primary care in the primary care and at the particularly the Eric Williams Medical Sciences Complex. 249 members of staff, ICU induction and care of the ventilated patient, and this targets RNs throughout. We've trained 123 members of staff. For infection prevention and control, which is critical and important to sustaining our nosocomial infection rate, we've trained 4,813 members of staff. For CPR or cardiopulmonary resuscitation, and this is for all PCAs or patient care assistants and as well as patient escorts, we've trained 317 members of staff. Basic life support, again, across the board, we've trained 778 members of staff. Psychosocial support and mental health awareness, and again, particularly for nursing staff, we've engaged 889 members of our nursing staff. We've also engaged webinar conversations for our staffing and twice per week, in a 1-hour webinars, which has been highly successful. We've engaged at least 648 members of staff in those conversations in mental health and the importance of sustaining your mental health, and as well the providing them with the tools. COVID-19 vaccine sensitization sessions, again critical in the sector. We've engaged 771 members of our staff directly. The swab training, 197 members of staff. Respiratory spirometry training, again critical during COVID. We've trained at least 100 members of staff. ECG training for general members of staff in a worst case scenario. We've trained at least 100 members of staff. Basic emergency care or ECT boot camp for nurses. We've engaged them in these refresher courses of 658 nurses. The care for the ventilated patients, and again, this is refresher training for doctors, registered nurses, sharpening the saw. We've retrained 305 nurses, and intensive care training for employees, doctors and nurses, over 100, and similarly, intensive care training for lower level staff, worst case scenario, 687 members of staff, managing crisis during times of conflict. We've trained over 200 members of staff, lifting and moving, handling of the critically ill patient, 300 members of staff, principles of accurate documentation, particularly for COVID-19 patients, over 200 members of staff, medication safety guidelines, 200 members of staff, and ward management for the COVID-19 patients and staff. We've trained particularly for our clinical staff and ward management staff, at least 100 members of staff. Thank you very much, Al.
Thank you very much, Mr. Thomas, for that very detailed update. As we move into our question and answer segment, our media representatives are reminded to state your name and that of the media house that you represent. You would be allowed two brief questions in the first instance. Please identify the panelists to whom you wish to address each question. And of course, time permitting, we will accommodate a second round of questions. We will take our first question this morning from Guardian Media Limited.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. My two questions are for the Chief Medical Officer. Dr. Parasram, firstly, can we have an update on those vaccines which went missing within the Southwest Regional Health Authority? How many doses, what brand, and where that investigation is, if at all, making any progress? And secondly, could you say within this first week of the safe zones operating that went by there, how many inspections were done and how many establishments were found to be in breach and what types of establishment they were? Thank you.
Sure. I think the Southwest Regional Health Authority was in contact with the police on this matter, and there's an ongoing investigation. So I don't want to give too much details as to intricate details at this point, just as the investigation is ongoing. By way of investigating various safe zone facilities, we have done, I think, upwards of 150 inspections as of Friday last week. I'm having a meeting again with the enforcement agencies right after this press conference to go through the types of enforcement issues that we were having, trying to streamline the way we look at vaccination cards, making sure all the enforcement agencies are on the same page and know what we're looking for. But from a public health perspective, every incident we have occurred, have picked up, we have referred that directly to the TTPS for enforcement. So again, I will meet with them right after this meeting, and we will have that discussion then, and then of course be able to give some more details to follow. In the most part, I can say there has been compliance with the TT safe zones of the ones that have been inspected by the PHIs. So there are minor issues relating to even outside of the safe zone, people wearing masks in certain jurisdictions, and those matters have been referred to the police. But generally speaking, there seems to be good compliance, at least from the inspection report I got as of Friday last week.
Thank you very much, CMO. We go to Radio Tamron for your two questions. Good morning.
Yes, good morning. Clayton Clark from Radio Tamron. My questions are for the Chief Medical Officer, and they are all sports related. Is there any sporting organization approaching the Ministry of Health to make arrangements to have their sporting discipline or members of their sporting disciplines vaccinated so that they can return to play in a safe zone environment? And the second question, has there been any daily positive cases, or has there been any link? Let me read that again. Has there any daily positive cases showing a link to sporting activities of any kind? Any link between sporting activities and the daily positive cases as recorded by the Ministry of Health?
Okay.
Thank you.
So in terms of the first question, if I get it clearly, you're asking if bodies have reached out to the ministry to be vaccinated or to operate as a vaccinated group?
To operate as a vaccinated group.
Hello? If I could get clarity on that?
Well, so this is a question forwarded, so just trying to understand it. Have them vaccinated so that they can operate as a safe zone?
So vaccination, as you know, is widely available throughout the country at all the health centers and the mass vaccination sites. We have been doing some special groups, for example, persons going to the Olympics and representing the country national teams with regards to special requests for vaccination. There have been some requests to operate for different bodies to the Honourable Minister under the exemption process for certain sporting activities, and that is under his remit, of course, to give that exemption or not, based on some guidance as it relates forward. But just to remind persons, the TT Safe Zone policy in this phase, at least, in terms of the listed business places, those are the ones that will be part of the phase one. So the ones that are listed, of course, the restaurants and bars, the casinos, the cinemas and theaters, the betting houses, and the water parks are the first phase. Operating outside of that is not part of the safe zone policy at this point in time, in terms of fully vaccinated groups. Your second question relates to daily positives coming out of sporting groups. I don't have that granular detail from that. That is usually available to the CMOH office to see if they have clusters occurring from a particular event. As you know, team sports and contact sports are not occurring at this point in time. So I expect that we don't have those clusters coming out of that group, but I can do a check with the CMOHs and get back to you off air.
Thank you very much, CMO. We go to TV6 now. Good morning, TV6.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first two questions are for Dr. Parasram. Dr. Parasram, I was wondering if we have the actual figures in terms of how many breakthrough infections we've had among the vaccinated so far, how many deaths we've had among the fully vaccinated, and how many deaths we've had among the fully vaccinated relating to the Delta variant in particular. That's my first question. And the second question, I would have seen an article over the weekend where you had a family. You had two fully vaccinated persons, one unvaccinated person, and the two vaccinated persons, well, the person claimed that the two vaccinated persons would have died due to COVID while the unvaccinated person survived. Now, both persons were said to not have any comorbidities or any underlying health conditions. And I was wondering if you could just weigh in on that from a medical perspective.
Okay, so in terms of the deaths so far, what we said is just about 98% of deaths that occur in unvaccinated, not fully vaccinated people. I believe we have had 2 cases of Delta variant related deaths that have been reported in the media so far out of the lot. So hopefully that answers the questions related to the deaths. In terms of the media report, I think the Prime Minister and the Honourable Minister would have responded, and Dr. Trotman, on Saturday as it relates to that particular incident that occurred. It's a matter of focusing on the exception, and as I said, 98% of the people that die from COVID in Trinidad and Tobago has been not fully vaccinated. And the story would have carried an unfortunate incident where we had two persons in the same family, and condolences to the family passing away. And I think you stated a little wrongly there that they would have died from COVID. I think the story that was carried said that one of the persons would have passed away as a result of a heart attack, and that was in the article which was published in the paper. So again, everyone that dies and having being COVID positive at the time of death doesn't necessarily die of COVID. They are considered having COVID, and that has been our national policy for stating in terms of deaths that have come to us. Once you are positive at the time of death, we count you as a COVID death, whether it is with COVID or off COVID. So just to make it known that this is an exception, is not a rule in terms of deaths occurring in fully vaccinated individuals. A lot of times there are underlying pathologies that we find in the 28 deaths that occurred so far in people who are fully vaccinated. The majority of them have occurred with people who have significant comorbidities. For example, end-stage renal disease, for example, end-stage cancer, significantly older individuals, for example, who have immunocompromised states for other reasons. So those persons are the ones we have seen the deaths in the fully vaccinated individuals to the most part. So far, I hope that answers your question.
Thank you very much, CMO. AZP News, good morning. We are ready for your questions.
Good morning, Primary Harry, azpnews.com. My two questions are for the CMO, and I just wanted to follow up on Alicia's question. The people who had the Delta variant and passed away, were they not fully vaccinated? Just to clarify that, please. And my second question, in terms of the Delta variant, are we seeing more severe cases with persons who have the Delta? Thank you.
Okay, so let me just check my information. I have some details as to regard your first question. Right, I think I have from Dr. Hines some information when you asked the question last that those persons were unvaccinated, I believe. So yes, both of them were unvaccinated in terms of the Delta cases. Your second question refers to what again? Just remind me of the second question, Prior.
Their cases in Delta.
Yeah, so Delta, I mean, again, it is a variant of concern, meaning that they have characteristics that it is more transmissible, it is prone to, again, increasing risk of hospitalization, increasing severity, as opposed to the original lineage, which is the Wuhan lineage, and even the Alpha and the P1 lineage. However, it can have, again, asymptomatic forms of this disease. So it runs the full spectrum of clinical presentations, all the way from minor to severe disease. But it is prone, what we're seeing in the characteristics of more severe disease, as well as secondary attack rates.
Thank you, CMO. Newsday, good morning. We are ready for your questions. Mr. Douglas, good morning.
Yeah, hi. Good day, Mr. Alexander. Hi, how are you doing?
I am fine.
Great, good to see you. Now, well, I had two questions. The first one was the terms and conditions of doctors and nurses who are being seen as the heroes of this pandemic. We had a story in today's Newsday, I don't know if you could see it here, where the locum doctors have been asking for regularization of their tenure. And I know it's a similar situation of nurses. We're hearing nurses working under contract conditions and can't really go to the bank for a loan or so on. So I don't know if there's any update on that, please.
Is your second question?
I had a second question. Should I wait for an answer on this question or?
No, pose a question, please.
The second question? Okay. The second question is, I was on Facebook and there is quite a lot of very strong feelings among parents of children who have remained unvaccinated and out of the school system, because now we're having a drop I think Teachers Union has instructed no more online classes. And these children are really between a rock and a hard place. And quite a few had actually dropped out previously. So the strength of feeling, I'm really choosing my words carefully here, but the parents are really, some of them are expressing really, really strong feelings. So my question is, what would you want to say to them? Is there any plan to engage with them? And could you recap for us briefly why there is a need for children to be vaccinated now? Now we're going from the secondary school children, and with the most recent conversation has been primary school children. But at the start of the pandemic, children, it was seen that they were not in the priority groups at all. And we would imagine, well, they have stronger immune systems, they're less likely to have comorbidities and so forth. So the question is, what was the game changer? Is it the Delta variant? Was that the game changer? And what would be your message to the parents now who are really quite emotional? Thank you.
Yeah, so your first question, I think the Honourable Minister and the Honourable Prime Minister would have dealt with that matter prior in terms of terms and conditions. So I will leave that to be dealt with at that level. Your second question is really related to the Ministry of Education to the most part. There's not much more that we can add from a health perspective in that we continue to advocate for vaccination for that particular group. It is a risk of infection with Delta and with other variants of concern that may arise later on. And of course, as with any other group, the approval for that pediatric vaccine, as you know, would have only recently come from WHO. So it is not something that would have been changed all of a sudden. I think it came upon us when the pediatric vaccine was now available and had been approved by WHO that we took that step to go forward with the pediatric population, 12 to 18 first of all, and we look forward hopefully to some approval coming from WHO for an age group 3 to 17 as well for other types of vaccines in the future.
Thank you very much, CMO. We go back to Radio Tamrin for a follow-up question. Radio Tamrin?
Yes. Hello, you hear me now?
Yes, we are.
My follow-up question, another sporting question, is the Ministry of Health getting requests from sporting bodies to host activities?
Thank you.
Yeah, well, I suppose we can say yes to that one. Yeah.
It's a short and sharp response to that question. TV6, good morning. Your follow-up question.
Hi, yes. Dr. Parasram, I know that there were one or two cases that were under investigation where people had claimed that the vaccine was responsible for, fatalities, right? I know there were one or two situations that were under investigation, and I was just wondering if we could have an update as to overall among the total number of persons vaccinated, how many serious adverse events we've had, and as to whether anything has come out of these investigations in terms of findings. Thank you.
So I could say that we have not had any deaths related to vaccinations in Trinidad and Tobago. As of this time, we have given more than 1 million doses of vaccines, and to date we have no deaths directly related to vaccination in Trinidad and Tobago. Having to report upstream by way of adverse events, I would say it would be less than 10 I would have had to report to the Pan American Health Organization or any other organization. Last count I would have had about 5 that we referred, and those are, as you know, sometimes we refer to PAHO as part of our normal surveillance function. So there's a regional head and then it goes to the global head. And we also refer sometimes to companies as part of the ongoing surveillance for the use of their vaccines if we have any adverse events. But they have all been in keeping with what is expected by the manufacturer and what was told to us. There haven't been anything unusual so far reported to PAHO.
Thank you very much. Guardian Media Limited, we are ready for your follow-up question.
Good morning again, everyone. CMO, I've heard with this whole Safe Zone initiative being rolled out that some places, such as gyms, which have a frequent membership, are asking people that, hey, instead of walking with your immunization card every time, let's make a copy and we'll keep it on file. Is that something that is allowed, or should there be any concerns around that when it comes to giving a copy of your personal medical records in such instances?
So yeah, I think it once it is kept confidentially, I think we are okay. I mean, it is something that is allowing the membership of those particular institutions, gyms, and I think casinos are doing the same. That freedom of movement, so they don't have to check their documents every time they go to the system, and they make sure something is there, and they're also keeping a copy. So there's proof of vaccination for that particular member on site, which is very good. So I mean, it's something that could be loaded, I suppose, for those fraternities, and it helps the membership move more easily in and out of this space.
Excellent question. Thank you very much, CMO, for your response. AZP News, we are ready for your follow-up question.
Good morning again, Private Harry, AZP News. I just wanted to follow up again with the CMO on the breakthrough cases that we are having. Are we seeing it with one particular vaccine? In other words, are more people who are fully vaccinated with one particular vaccine, you're having breakthrough cases than others? Thank you.
I wouldn't want to say yes. So what we have in the country is that we have a significant proportion of the country that has been vaccinated with the Sinopharm vaccine. Much more significant in terms of a percent than any other vaccine. So you basically have Sinopharm given to approximately, I think, is about just under 400,000 people. So the bulk of the vaccination program has been driven by Sinopharm. So if you're expecting to get proportionally breakthroughs, you will tend to get it more in that particular group than anybody else. But we have seen breakthrough infections from all vaccines that we have in Trinidad and Tobago. And worldwide, you have seen breakthroughs for all other types of vaccines as well. It's not specific to one vaccine type. A vaccine, and just to make the point, no vaccine will give you 100% protection from infection, from hospitalization or death. And we have said that from the start. So you have to bear that in mind, and that's why we maintain all other public health measures as essential once the viral levels in the country tend to be high. So it gives you added protection and provides that synergistic balance between vaccination and other public health measures to get your personal protection level as high as you could possibly get it. So we're asking, although you're vaccinated, of course, do all your public health measures, wearing your mask, keep your distance, wash your hands, and do all that needs to be done to protect you and your family.
Thank you, CMO. We go back to Guardian Media Limited for a follow-up question.
My follow-up question here is just for a little bit more explanation on the rationale of the beaches being closed, right? I know you would have said in the past that it's because masks would have to come off and any such setting is a danger, but I mean, there have been a numerous amount of reports and studies done that show that being outdoors really doesn't present that much of a risk for transmitting COVID-19. So I just want a little bit more of the rationale that is being used for such a policy.
Well, I think, Richard, you hit the nail on the head there. I think any circumstance where you have your mask not being worn, and that's why what I said previously, even though you may be vaccinated, puts you at risk of infection and then, of course, any other precursor of the illness. So we all know in terms of the way human populations move and the way they behave, although you may be in an outdoor environment, if you have close proximity to one person, both persons not wearing a mask, there's the possibility of spread between that person and the next. The circulating virus in the country is still very prevalent. We have a brand new variant on the scene. We have Delta variant, which is far more transmissible. It has been prone to aerosolization much more than the other viruses, meaning it can spread and linger in the air much for a longer period of time. So it is concerning, and the levels that we're seeing are still concerning. So much so and when you have beaches, of course, you have large groups of people coming together. We just made the Prime Minister would have just gone from 5 to 10 in terms of congregation to give a little ease. But I mean, 10, that is a small change. If you have beaches open, you expect to have congregation in a far greater number than 10. So we're being cautious, as we always are, and moving slowly We just did the TT Safe Zone initiative. We need to take a look at that and see what happens as well in terms of the number, if it bears anything out of it. Delta variant is increasing in terms of its prevalence in the country as we speak. We are hoping that the immunization coverage will keep pace with it, but chances are Delta will move a little faster than the immunization coverage will pick up. So we have to keep an eye on everything, and of course, as the Honorable Prime Minister will make adjustments in the future as he always does.
Thank you, CMO. TV6, that will be our final question for the day. TV6, we are ready for your question.
My final question goes to Mr. Thomas. I was wondering if you can give us, some figures in terms of vaccine uptake among your medical staff underneath the NCRHA, both doctors, nurses, medical staff, and what in terms of a percentage of your overall staff that those figures represent. Thank you.
Well, in terms of our clinical staff, our doctors in particular, at about 98%. Our nursing staff are somewhere around 63% and increasing. The general staff levels in terms of the normal clerical and so on are somewhere around 60%. So we continue to engage in our vaccination drives inherently. As you know, the staff are members of the community, and as that is increasing simultaneously, we've noted that our own staffing levels, but for doctors we are at 98% or so, nursing around 63%, and we've noted that with a lot of the particularly the psychosocial support that we're providing throughout the NCRHA, not in particular the interventions of the psychological nurses and psychiatrists and psychologists as well to engage resilience. We've noted that we've had substantial increase. Like, for example, we've had a 15% increase over the last month or so, particularly for nursing, and we're particularly positive about the possibility of increasing the numbers in that regard.
Thank you very much, Mr. Thomas. Ladies and gentlemen, we have come to the end of our question and answer segment. We thank the media for their very engaging questions, our panelists for their responses, and you, our viewing and listening public, for tuning in to this update. In closing, we ask that you please continue to protect yourself and your loved ones. For up-to-date and reliable information on COVID-19, please go to the Ministry of Health's website at www.health.gov.tt or visit our social media handles. If you haven't received your COVID-19 vaccination as yet, please get yours now. Don't delay. Vaccinate today. Goodbye for now.
Imagine not being able to breathe. Doc, I can't breathe. I can't take a full breath. And this is very important. Imagine not being able to breathe for a prolonged period of time, despite high oxygen requirements.
I find it very disheartening to come to work and see a lot of my patients from the day before or 2 days before not there again.
I am pleading with you to avoid becoming an AGU and ICU patient. Please don't delay. Vaccinate today.
You tell Maria to put the prompt on 45 for me, please.